Hi, my name is Eric Fontaine. I'm a physical therapist here at Hands on Healing in Bethlehem, Pennsylvania. I'm just here to talk to you a little bit today about sciatica. So we've been having a lot of patients show up in the clinic lately complaining of sciatica. And it's a pretty common condition. Maybe you've had a family member or a friend talk to you about sciatica, and I feel like a lot of people have heard of it. But I think a lot of these issues lately have been related to the coronavirus. So people are staying home more, they're less active, they maybe have changed their work environment a little bit. And those things can all be kind of playing into this. So let's start from the beginning. So what is sciatica? Well, it's irritation of the sciatic nerve, which is a big nerve that runs down from your back, down the back of your leg, all the way to your foot. It kind of splits along the way, but in general, that's the sciatic nerve. And it does a lot of important jobs. It supplies sensation to the leg. It makes some of the leg muscles move. And so it does a lot of really important jobs. So when it gets irritated, it can lead to pain, numbness that kind of shoot down the leg in that pattern. So it can be caused by a lot of different things. One of the biggest things that people often complain of is like a herniated disc in the back, but it can also be caused by things like spinal stenosis, which is just like a narrowing within the bones of the low back. It can be caused by issues at the hip joints, like at the joint between the hip bones and your tailbone. Sometimes that can cause some of these issues, as well as different like muscle tightness. So if you have a lot of really tight muscles in the hip and the back and the butt, it can press on the nerve and cause some discomfort as well. So in general, though, studies have estimated that about 2.2% of the general population will have some sciatica episode annually. So it affects a lot of people. It's very common. And certain risk factors apply to this. So a little bit older age, if you're between the ages of 45 to 65, that's the most common time that people experience this, although you can experience it outside that age range as well. Taller people are a little bit more affected, as are more obese individuals or smokers. And even sometimes some activities can bother things. So if you do a lot of frequent bending and twisting at your job, or if you drive a lot and you go over a lot of bumpy roads, those things can bother sciatica symptoms as well. So what can we do? Well, a lot of the issues can be caused by weakness within the back, the hips, the legs, or even stiffness in those areas as well. And because there can be so many things that influence sciatica, it's really important to try to figure out what might be causing these symptoms in the first place. So if you can identify that a certain area is tight or a certain area is weak, trying to correct those issues can be really, really helpful. I think additionally, changing sometimes how a person does certain activities. So if you do a lot of bending and lifting, trying to do those with better form can be really important. Or perhaps you have you've changed and you're working from home now and you have a weird workplace setup. Sometimes that can bother things. So investing in a nicer chair or a nicer table to really support you can be really good. And even sometimes just changing how your car seat's set up, especially if you do a lot of driving, that can be a really big thing. And physical therapy is really ideally situated to deal with a lot of this because, we're educated in educating others. We're educated in trying to modify lifestyles and how people do things to be more effective for them. And of course, we're also really good at dealing with muscular tightness and weakness and things like that. So we were definitely equipped to try to figure out what might be causing the problem and coming up with solutions for that. So in general, sciatica will improve just over time, and a lot of times the first step recommended by physicians is just some over-the-counter pain medication, heat and ice. I mean, obviously talk to your doctor if you're taking a lot of other medications for other health issues, but those are generally the first step. And then if cases are not resolving quickly enough or it's taking a bit of time, they may often suggest physical therapy as well to help address that. In very severe cases, like in cases where you're starting to get pain, numbness down both legs, or you're starting to experience numbness within the groin, we can call the saddle region, maybe some dysfunction with how your bowel and your bladder is working, those are a little bit more severe cases. Those are definitely more of a medical emergency and would warrant talking to your doctor as soon as possible about those issues, because they can lead to long-term problems. But in most cases, some physical therapy can be really, really helpful. So hopefully you're not having some sciatica problems, but if you are, or maybe you know somebody who is, definitely checking out an access office to help can be really, really helpful, and definitely try going to the website to check us out. So if you have any other questions, definitely feel free to contact us, and I hope you're having a good day.